Dr. Madan Kandula with Advent today talking about CT or CAT scan imaging and why it's so crucial for everything that we do here at Advent. So this is the CT, this is my computer, so all of our offices have in-office CT imaging, so those go through the cloud up online here, and so when we do a CT on somebody, we're looking at a laptop like this and walking you through, so I'll just sort of demonstrate what I typically do, which is this. So each of these rectangles or squares here is a cut through somebody's face coming straight up and down. We're just walking our way backwards. So CT imaging is X-ray imaging in 3 dimensions, and so what this allows us to do is see beneath the surface of the face and into the sinuses and into the skull. So everything that's white here is bone. Everything that's gray here is soft tissue, and so in this cut here we can see left eye, right cheek, left cheek, and then you see the white that I was talking about. Now there's white here, that's this patient's forehead, but then there are these black areas here and here. Black is air, and so when we see these areas here, those are the sinuses in the forehead, and those sinuses on this CT scan are generally looking okay. Here is the nose, and that's the inside of the nose. The gray structure, that line that we see going straight up and down, is the septum. The septum divides the nose into 2 sides, left side and right side. And so when we see this septum here, at this point not looking bad, black area here is the left breathing passage, the black area here is the right breathing passage, and so you can see that right out of the gate here, the right side is a little tighter than the left-hand side, and then these little structures down low, here and here, are the turbinates, which are the humidifiers of the nose, and so the turbinates are the areas that you breathe between. The septum, when you take a breath in through your nose, you're breathing between the septum and the turbinates, and airflow is coming straight back in the nose. And then this is the patient's mouth down here. So forehead, nose, mouth. And then when we go like this, we're just going back into the face a little bit, a millimeter or so. The septum at this point we start to see is deviated. So it starts leaning towards the right-hand side and then coming down. Now we start seeing the cheek sinuses, which are these areas here and here. And once again, black is what we want to see. So those are looking okay. As we go further back in, we continue to see the same structures, and we're just following this going backwards. The septum at this point takes a pretty significant curve side to side towards the right-hand side up high, left-hand side down low. We continue to see the turbinates, and now we see the cheek sinuses here and here. Within those cheek sinuses, and we'll see a little bit more in a second, we start seeing some grayness. So gray at the bottom here, gray at the bottom here. That gray that we see in those sinuses is the lining of the sinuses that's inflamed in a chronic manner. So the gray should not be there. This should typically, and if things are healthy, this should go from black to white. That means air to bone, and the lining of the sinuses shouldn't be inflamed. Now we're heading further back in, and as we continue to do that, now we start seeing the septum that was bent towards the right-hand side all of a sudden has a spur towards the left-hand side. So that area that sticks out right there is called a septal spur. That shouldn't be there. So that's part of the septum that's deviated. So this patient's septum is affecting them on both the right-hand side and the left-hand side. They have chronic inflammation up in the sinuses and the cheek sinuses, as well as turbinates that are bigger than they ideally ought to be. And then as we keep going back further yet again, now we're getting to the very, very back of the nose. And now we start seeing the very last set of sinuses, which are here and here. And we can see at the very, very back sinuses for this patient, there's on the left-hand side black, that means there's air, that's pretty good. On the right-hand side, we see that there's gray. That gray should not be there. That gray is chronic inflammation that's staying stuck in that sinus. And so this isn't really helping this patient at all. And then we get to the very, very, very back of the nose back here. We continue to see that inflammation in that right very back sinus. And so that is a CT scan of the sinuses. It lets us see back to front, top to bottom, inside. You can't see any of these areas. We can't see into these sinus areas without imaging. So if we're trying to diagnose somebody with either tight sinuses or sinus inflammation, the only way to do that, if it's a chronic issue, is with this. So X-ray imaging, CT or CAT scan imaging, that is what we're seeing, and that's why it's so important.